The work at the Contraception and Abortion Research Team is founded on a principle of equity. We believe that throughout Canada, all of our underserved groups and populations need to have more equitable access to the knowledge, the methods, and the services they require to be able to realize their own reproductive goals. So our Contraception and Abortion Research Team has been working with provincial and federal governments to be able to change more than a dozen policies across the country to improve the equitable access to contraception and abortion. Some of these have been our work to bring in the contraceptive implant, a small match-like stick that can go under the skin in the arm and last for up to 3 years to be more effective than permanent sterilization at preventing a pregnancy, and yet can be removed at any time somebody doesn't want it. Our work has also been with the First Nations and Inuit Health Branch, and CART gave an invited proposal on the range of contraceptives that should be included. Within 6 weeks, all across the country, the federal government changed the requirement and increased the range of contraceptives and decreased the thresholds that they were requiring people to meet to be able to qualify to reach them. And so for First Nations and Inuit status people throughout the country, they now have a wider range of contraceptives due to invited evidence from CART that was supported by BC Women's Hospital and the BC Women's Foundation. Finally, one of the things we're really excited about is the ability we've been able to support for people to access abortion care through their primary care provider, their nurse practitioner or their general practitioner or family doctor. And people no longer had to travel into the big cities to go to the big abortion clinics. People no longer had to walk through a line of protesters before they were able to access their abortion. People were able to confidentially see their local nurse practitioner or family doctor, talk about this in a place where nobody knew they were seeking an abortion, receive their care in a confidential manner at home with a trusted provider. And we're exceptionally proud that this research was supported by BC Women's and the BC Women's Foundation to allow our research team, the Contraception and Abortion Research Team, bring this evidence to federal decision makers to change the regulations for everyone and improve equity throughout the country. Some of the amazing things that we've been able to do include research that helped the provincial government to make a decision to provide free contraception at the time of abortion for all people in BC when they have their abortions. What we've found as we've looked to see how this policy rolled out over the last 5 years is that this helped these people to prevent 40% of the unintended pregnancies that would happen in the 2 years after an abortion by the policy allowing them to have free contraception. One of the other things that we're really excited about is a study we were able to conduct with the partnership of BC Women's Hospital and, of course, all of the help that they give us by allowing us to have our whole team space within the Women's Health Research Institute. We conducted a study in all corners of BC asking people about their experiences to plan and time and space their pregnancies and what challenges they faced. And using that data, we were able to make a very strong proposal to the provincial government that contraception should be free for all. And in the minister's letter to the Minister of Health from the Premier, as well as in the work plan of the Ministry of Health, they have now promised to make prescription contraception free for all throughout BC. And we're proud of the support that we've had from BC Women's Hospital and the BC Women's Hospital Foundation to be able to enable us to provide top quality evidence that supports policies that help people capable of pregnancy everywhere in our province.